Studying medicine is so much more than knowing what's in the textbook. Being a good doctor comprises having the soft skills to be able to effectively communicate with your patients, and this is where our communication suite comes in. Here is where we practice our physical exam and history taking with simulated patients. Let me now introduce you to Dr. Tanya, our Assistant Dean for Clinical Communications.
Hello, hi, really nice to meet you. Welcome to the Communication Suite. So yes, this is where we practice communication and physical examination. You can see we've got lots of rooms here. We've actually got 21 rooms, so many students can practice at the same time. Maybe you'd like to come and take a seat inside one of the rooms. So I mentioned simulated patients just now. This is Sheena, she's one of our simulated patients. But today she's going to be a patient called Rachel Ling. And Jeremy, one of our students, is going to demonstrate some history taking for you. So, so Rachel Ling has come to the polyclinic today. And Jeremy's going to spend some time speaking with her before she sees the doctor.
Good afternoon, ma'am. My name is Jeremy. I'm a medical student in the team. How may I address you?
Rachel.
Rachel, could I have your full name and NRIC?
Rachel Ling, T002025L.
Thank you very much, Rachel. Rachel, today I'm here to talk to you about the reason you came in and about your medical history.
Okay.
Anything you tell me remains confidential. Would that be okay with you?
Yeah, okay.
Before we begin, Rachel, are you comfortable to proceed?
Yeah.
Okay, Rachel, why don't you tell me what happened?
I've been having some problems when I pee.
Tell me more.
Well, it's been going on for a few days, and it hurts when I have to pee. And today when I went to the toilet, I noticed that my urine was a bit pink. So I thought that I should come see a doctor.
I think it's great that you came in. I'm really sorry to hear all that. Anything else you noticed?
When I do need to go, I feel the urge to go quite often, but when I actually do, there's only a little bit that comes out.
Okay, we're just going to ask you.
Should we pause there? Okay, lovely. So, as you can see, we practice in these rooms, but the other really important part of a session is the ability to get feedback on what was done well and what could be improved. And the feedback comes from the simulated patient, from other students in your group, and also from the facilitator, the clinician who is running the session. So should we ask Sheena to give Jeremy some feedback?
Okay. Hi Jeremy, I thought you did very well. Your overall demeanor was very calm and professional, and that put me at ease. And you assured me very early on about confidentiality, which also made me feel more comfortable sharing my story with you, because I'm not that comfortable sharing initially, because it's a rather awkward situation. So because you put me at ease, it made it easier for me to share. So good job.
Thank you very much, Sheena.
No problem.
Okay, lovely. So you get verbal feedback from the simulated patient and from students and from facilitators, and also we give you feedback in written form as well through an iPad app. So that means that you get a feedback form that you get to keep as well. That's another way to get feedback. The other thing you may have noticed in here is you can see that there's a TV screen on the wall. Now I'm sure you can imagine that if you were doing a role play like this and your teammates were watching you, it might feel a little bit nerve-wracking. So usually what we do is actually have the role play happen in the room next door, and then you just feel like it's just you and the patient, and that's not quite as nerve-wracking, and everyone else is watching on the TV screen from in here. Okay, so what I'm wondering is maybe would you like to take a seat here and ask our patient a couple of questions, yeah? Maybe you can ask her something along the lines of, how is this affecting your life on a day-to-day basis, something like that. Okay, so Jeremy, do you want to let her take the seat here?
How is it affecting my life? Well, right now I'm in uni, and because I just started, the coursework feels a little bit overwhelming and it's all very stressful.
Okay, Lovely, well done. Okay, so let's see if Sheena has any feedback for you about that. Okay, would you like to give her some feedback?
Hi. So I really like that you asked about how the condition is affecting my life, because it made me feel like I'm not just this illness or whatever I'm going through, I'm a person, and that you care about me as well. So that really helped to build a lot of rapport over there, so good job.
Okay, well done. So thank you so much for coming in and visiting the Communication Suite today. I really hope to see you here in the future in person. So I'll hand you back to Karen now.
Thank you, Dr. Tanya, for the informative tour on our Communication Suite. The time has now come for me to hand you back over to Jerome to do the rest of the tour. I'd like to thank you for joining us, and we hope you've had a good time, and we hope to see you here in LKC Medicine. Over to you, Jerome.